the dynamic lung function tests. Well, I mentioned 4 types of these tests: forced vital capacity, forced expiratory volume, maximum ventilation volume, and peak expiratory flow rate. So let's see what they actually are. First up is forced vital capacity. Forced vital capacity, or FVC, is the volume of air that can be exhaled forcefully and rapidly after a maximal or deep inspiration. It is a dynamic lung capacity. Normally, forced vital capacity is equal to the vital capacity. You can see here the FVC in a healthy adult on this graph. However, in some pulmonary diseases, FVC is decreased. Next, we have forced expiratory volume, or timed vital capacity. Now, forced expiratory volume, FEV, is the volume of air which can be expired forcefully in a given unit of time after a deep inspiration. It is also called timed vital capacity or forced expiratory vital capacity, FEVC. It is a dynamic lung volume. Now, let's have a look at the forced expiratory volume in persons with normal respiratory functions. Well, FEV1 is the volume of air expired forcefully in 1 second. It's about 83% of total vital capacity. While FEE2 is the volume of air expired forcefully in 2 seconds, and this is about 94% of total vital capacity. FEV3 is the volume of air expired forcefully in 3 seconds, and it is about 97% of total vital capacity. Now, after 3rd second, it is 100% of total vital capacity. Vital capacity may be almost normal in some of the respiratory diseases. Normal FEV1 is shown here in the graph. However, the FEAV has great diagnostic value, as it is decreased significantly in some respiratory diseases. It is slightly reduced in some restrictive respiratory diseases, like fibrosis of lungs, and very much decreased in obstructive diseases, like asthma and emphysema. So, the third dynamic lung function test we are going to discuss is maximum breathing capacity, or MBC, also known as maximum ventilation volume, or MVV, which is the maximum volume of air which can be breathed in and out of lungs by forceful respiration per minute. Here, by forceful respiration, I mean hyperventilation, that is, increase in both rate and force of respiration. Now remember that MBC is a dynamic lung capacity. This is also reduced in respiratory diseases. In healthy adult male, it is 150 to 170 liters per minute, and in females, it is 80 to 100 liters per minute. Now the last one is the peak expiratory flow rate, or PEFR, which is the maximum rate at which the air can be expired after a deep inspiration. In normal persons, it is 400 liter per minute. It is measured by using right peak flow meter or a mini peak flow meter. Now, its determination is useful for assessing the respiratory diseases, especially to differentiate the obstructive and restrictive diseases. Generally speaking, PEFR is reduced in all type of respiratory disease. Now, let's look at the same graph again. PEFR is the maximum slope of the curve, and here, in healthy adult, it's 400 liters per minute. Now, in restrictive diseases, you can see the slope slightly decreasing. So, PEFR is reduced from 400 liters per minute to about 200 liters per minute. Now, the reduction is more significant in the obstructive diseases, and you can see the slope decreasing even more. Hence, PEFR is reduced to 100 liter per minute. So, that was about the lung function tests. Now, I was using the term restrictive and obstructive respiratory diseases again and again. Let me help you differentiate between them. So, diseases of respiratory tract are classified into two types: restrictive respiratory disease, obstructive respiratory disease. These two types of respiratory diseases are determined by lung functions tests, particularly FEV. Now, restrictive respiratory disease is the abnormal respiratory condition restricts a person's ability to inhale air. So, it is characterized by difficulty in inspiration, while expiration is not affected here. Restrictive respiratory disease may be caused by the abnormality of lungs, thoracic cavity, or nervous system. Well, the restrictive respiratory diseases involving thoracic cavity include flail chest or broken ribs, and pleural effusion, while those involving central nervous system include poliomyelitis, paralysis of diaphragm, and spinal cord diseases, while myasthenia gravis involved both CNS and thoracic cavity. While obstructive respiratory disease is the abnormal respiratory condition characterized by difficulty in expiration. It is caused by an obstruction in the air passage. Here, inflammation and swelling can cause the airways to become narrowed or blocked, making it difficult to expel air from the lungs. Now, obstructive respiratory diseases of upper respiratory tract include laryngotracheobronchitis, epiglottitis, tumors, and severe cough and cold with phlegm. While those involving lower respiratory tract include asthma, chronic bronchitis, emphysema, and cystic fibrosis. So here we reach the end of the video, where we discussed the movement of lungs during inspiration and expiration, factors causing and preventing lung collapse, then lung compliance, work of breathing, and the assessment of lung function through static and dynamic lung function tests. I hope you are much clearer about lung mechanics now, and this is going to help you in your exams for sure. Goodbye. See you next time.